Hello, my name is Dr. Pedro Gutierres and I'm a dentist practicing in London. Today I would like to talk to you about wisdom teeth. So wisdom teeth or third molars, they're the teeth right at the back of our mouth, and they're teeth that we used to use many generations ago to chew a type of diet that we no longer have these days. So we used to use them to chew things like raw meat, plant meats. These days our diet is much softer, so we tend to use mainly our first and second premolars and the first molar. We do use the tooth next to that one, the second molar, but we don't use so much the wisdom teeth or the third molars. So these are teeth that we're losing with evolution, and they're too far at the back for us to clean them and maintain them properly on a daily basis. So often there will be some food and plaque bacteria accumulation on these back teeth, and they're teeth that are prone to get infection and to get tooth decay. So in the vast majority of the patients, they're teeth that are not of any benefit, and often we consider as the best option to just remove them. Typically the treatment will consist in numbing the gums. More often than not, we provide this sort of treatments here at the practice under intravenous conscious sedation, where we give the patient a sedative that is going to leave the patient more calm and relaxed throughout the treatment. It is a pain-free treatment because the patient is numb, so there is no pain with the wisdom tooth removal. And the treatment does take between an hour to an hour and 15 minutes in the chair. We take time to numb the area properly, to reassure the patient. Often there's x-rays that were taken in advance of the day of the surgical procedure. And we try and talk with the patient as we go along to reassure the patient of how the procedure is taking place. Then we typically will leave the patient with some dissolvable stitches. In a week later, that patient will come and have these stitches removed, and it will allow us to review the site and make sure that the healing is uneventful. The recovery period typically will be the day of the treatment and the day after to rest at home. Then the second day, depending on what the patient will do, what the profession is, typically they'll be able to go and work. Not everybody heals the same, but often we can provide the patients with something called plasma-rich factors, and we can actually speed up the recovery by using the healing components of the patient's own blood onto the area where we've taken the teeth. That will speed up the recovery and make the whole gum heal much quicker. So the day of the treatment and the day after, typically we recommend to rest at home, and then the patient can go to their day-to-day without having to worry about the wisdom teeth sites. For about a week, the food is not the same. The patient won't be chewing as comfortably on the side where we've taken the tooth or the teeth out, but after 1 to 2 weeks, then the chewing goes back to normal on the area.